Hello, everybody. Welcome to On the Homefront. My name is John Murphy. Thanks for sharing some of your time with me this week. You might be catching us live here on WILI at AM 1400 or 95.3 on the digital FM. We're also on Charter Spectrum Public Access TV now, channel 192 for customers in the Northeast region, channel 192 on Tuesday afternoons at 5:30 now, and Friday nights at 8. And we're going to be on WICH very soon, and that will cover Norwich and New London. So we're very happy to have our studio base here in Willimantic, and we're trying to cover more and more of the 3 counties in our region. Got another busy show today. We're going to talk about public access TV in our region right now. The public access channel is having an open house for new people to join. That's coming up on June 8th. And then at the end of the show, we're going to have a report and an update from the Connecticut tenant unions. We've been covering them for many months now. There's a lot of activity around the state. People are trying to respond to all the stresses about housing and relationships with landlords and tenants, that the courts are getting clogged with lots of unresolved problems. And one solution people are finding is to join a tenant union. So we'll talk with Luke later on in the show today. And I'm very happy to start out again with an issue we've covered for a long time that covers the whole region, which is healthcare. And our healthcare delivery system is undergoing major changes in access and delivery and funding and costs. And we're going to spend some time today with a coalition of people in our region and the eastern half of the state. It's the Windham United to Save Our Healthcare Coalition. I've got 2 members here with me for an update on the process underway to deal with healthcare changes and some of the decisions affecting us who are in the area served by Windham Hospital. Sitting next to me, I'm very happy to have 2 members today, Brenda Buchbinder and Cheryl Champ. Thank you very much. You've been here several times before. Thanks for sharing some time again today.
Pleasure to be back.
And I guess we should also bring Maxie into the show. He's our official mascot for the day. So I think one thing that we should do, this whole healthcare thing is in the news. There's not as much coverage as there used to be, but the system itself has gone through so much change. What I want to do for just the opening is have these 2 folks explain where the coalition came from, why it was started, what made it a public response to these changes, and then we're going to look at a process underway to review and correct decisions, and we'll see where that legal process goes. So thanks for giving us the little start to where you folks came together and who's involved in your coalition.
Okay, thank you for having us back. It's a pleasure to talk directly to the community. We believe healthcare is something that is a public access service. Windham United to Save Our Healthcare Coalition began the summer of 2020, shortly after the unilateral closure of our 87-year-old maternity unit by Hartford Healthcare. There was no certificate of need. There was no discussion with the community before. They just closed it. This was in the height of the pandemic without a vaccine. So we went door to door, masked up, gloved up, talking to people and letting them know. And there were a lot of tears and a lot of I didn't knows. We are now 13 community groups, and we have joined some of the state legislature things going on, the Public Health Committee, the Certificate of Need Task Forces for changing the way the Certificate of Need works. We have submitted thousands of stories. We have talked to public radio, public TV. We have submitted many of these on the Homefront stories, and we would like to update. We will be at the Boombox Parade this year. And we encourage you to look at our Facebook page, Windham United to Save Our Healthcare, and it will have the specifics of where to line up, what to bring, and we are marching. And if you have a particular desire to serve on a committee or you have a story of impact that you want to tell, we have a message place. You can leave it right on our Facebook with how to contact you, and we will add you to our library of stories. We have brand new apartments on Main Street and a call for new teachers in this community, young new teachers of childbearing age, and they're turning away from our community because they don't have a full-service local hospital. So we are losing a population of people that would come and settle here because our local services have been consolidated away.
Let me ask you a larger question now, because prior to the actions by Windham Hospital that affected our local community, the system was already going through decisions. There were much larger decisions made years ago to privatize part of our health care, which was a new concept in some ways. And the whole concept of a privatized model which builds in profit for investor return, was viewed as a way to achieve efficiency, among other benefits that were articulated. And now it's been many years where that model has been applied. And now we're looking at consequences and effects and corrections. Like any model, it could be fine-tuned. So one thing I know you're struggling with is collecting data that they use to make their decisions in order to understand their arguments. Because unless you understand their argument, it's hard to move forward. But they do have a study that's required. That's one thing I know that is why we're doing it now in early June. The process underway now involves a study of feasibility. And maybe you could briefly describe that study and why it was ordered.
Yes.
And when do you think that might be done to help people find better answers?
Okay.
Right.
This past December 2023, the state and the Office of Health Strategy and Hartford Healthcare, doing business as Windham Hospital, made a contract that the maternity unit could remain closed forever, and that they would do a feasibility study from an independent entity about whether they could build a birthing center here. And that's problematic from the beginning because you need an ICU to have a birthing center.
Well, do you have to have an ICU at the center, or I've heard arguments that it has to be nearby?
The question of near is the question of the day here.
Okay.
Bacchus
Sure.
Bacchus is not near. Bacchus is 30 or more minutes away. It's down a back road without a shoulder on the road, and sometimes in bad weather it's not travelable. If you have someone in emergency conditions, a lot can happen between Windham and there.
Yeah, for sure.
Yep.
That's life.
Yep. So instead of the ICU in 2015, we didn't know that Bacchus was bought the year before. They cut a lot of things. Our ICU was cut, despite all this protest in town. Diabetes care, nutrition, a sleep lab, general surgery, wound care. And they reduced our beds from 130 to 32 inpatient beds. They cut 119 staff positions, including 90 nurses. And they gave us what's called a progressive care unit, which is still in operation today. It's a 12-bed unit. 4 of them are progressive care unit beds, and 8 of them are med-surgical recovery beds. I am told we went from a critical care hospital, which was a community-based hospital, fully serviced, to now what's called an acute care short-term hospital. That means lighter surgeries. That means lighter recovery. And everything else will be flown out or ambulanced out. In 2023, people who were working at Windham Hospital, or AFT members did, notice the doors were closed to the PCU many days. So AFT filed an appeal to the state of Connecticut and asking them, it seems to be closed. Is it open or is it closed? And so it took until March 27th this year for Hartford Healthcare. And they reported they closed it for 274 days out of 365. These were kind of checkerboard that wasn't consistently, because 180 days of closure means that the services are terminated. So it will be closed for a month, open for a few days, back again closed, and very inconsistently open. So that's of concern. And we don't have any statistics for the other years from 2015 to 2023 that they were running the PCU, but I'm going to guess it was closed a lot of that time. And they blamed it on inadequate staffing. The staff were unwilling to cover the shifts, and the only option was to outsource to Bacchus and to Hartford. So the staff were blamed.
Well, one thing that I wanted to clarify is some arguments will be that there was not enough demand for the service and there weren't enough people knocking on the door. The numbers went down. The thing that you described is different. Mm-hmm. You're saying people are at the door, but the staffing isn't there to support people at the door.
Correct.
Okay, just clarifying a bit.
That is their writing, and I have the report there.
Yeah,
so that's what they blame that.
Right.
Okay.
Actually, part of my challenge, trying to be fair in this story.
Yeah, sure. Go ahead. Cheryl wanted to say something.
Because, for example, Cheryl She was a nurse for many years at Windham Hospital, among other health profession jobs.
Yeah.
But at a larger level, Yale is buying hospitals, Hartford is buying hospitals, hospitals in financial stress are being bought and traded, and the people that are working there are caught up in this, as well as people who depend on them for their care. So this isn't just our hospital being confused in a vacuum. And I know you've talked about this before. It's happening at different levels around the state, and the coverage is still hard to connect the dots, which is why sometimes I feel confused trying to share this with you, but the dots have to find a way to connect.
Right. And I just want to interject just one important aspect is the fact that whether or not birthing a baby is a profit for somebody's business, be it a physician or a corporation, that should not be the defining reason as to why women can have safe births of their children. You know, there was a time when people would just naturally go to their hospital to have a baby. And this was, of course, after about 100 years ago or so, when physicians started taking over healthcare, they removed midwives, and they had wealthy people go to the hospital to have their babies. But the babies that did better were the babies that were born at home, because the physicians back in those days didn't have any background in biochemistry and didn't realize that they were contaminating these mothers who ended up dying, many of them. And a lot of those babies that were born in those hospitals went home with no mothers. So it's a circular thing. Mm-hmm. And I think it's really important for our society to wake up and catch what's going on. Everything cannot be a corporation. Corporations will never be people. And people have to open up their hearts and their minds and speak up for people who may be too overburdened to be able to, say, join a coalition and push back. And many of these people don't even know that they had rights that were taken away from them. And I'm very concerned. I don't live close to Windham Hospital anymore. I'm 35 minutes away. And this issue moves me so much that I will come in and speak and do whatever I can to push back and open up the minds and hearts of people to understand that humanity cannot say there's no room at the inn.
Thank you.
Okay, so what I want to do to kind of wrap up this segment for now, because we're doing this in early June this year, but we'll come back to it later in the summer, or if anything concrete happens with this feasibility study, then we'll try to get to it right away. There's no real timetable yet for that study, right? There's nothing you're expecting right now except to wait?
The state of Connecticut put more parameters out for birthing centers and how it's to be studied and all of that. So they're starting to count the clock this month.
Okay.
So they gave them, I think, a 6-month window. So it would have been starting now, but there's,
All right.
they're starting
Well,
the counting from now.
And what we'll try to do in future conversations is try to get other members of the coalition in from other groups to talk about storytelling, to make it more concrete. And then coming into the new session, we'll talk about some of the bills that made it or some of the ones that didn't get through this session. That's another conversation. But I want to thank Brenda Buchbinder and Cheryl Champ for being here today. They're from the Windham United to Save Our Healthcare Coalition. I want to thank you for coming on periodically, and we'll have you back later in the summer.
Thank you so much.
John. Thank you.
Pleasure.
And also, real quick, the Facebook group is the same name, all right?
Windham
Facebook.
United to Save Our Healthcare.
And you also have a website.
Yes.
Go ahead. Same name?
Yes.
There you go. You can't get easier. Even I can remember that one. Windham United to Save
And
Our
feel
Healthcare.
free to reach out if you're part of a group wherever you may live here in the Windham County. Our coalition would welcome you with open arms.
Okay.
Absolutely.
All righty. Well, thanks again.
Happy Father's Day coming up, and we missed Mother's Day, but happy for the parents. We honor you by being here today.
Okay, it's a good way to wrap it up then.
Yes.
Thank you.
Okay, a little musical break, and we'll come right back. Don't go away. Okay, we're back here on the Homefront. Very happy to have you with us. If you'd like to join us in a future program, please use the email and we'll make arrangements for you all summer long. Just use john@humanartsmedia.com. We'll be very happy to share information you send us. If you have a larger story and you want to come on the house here or have a phone call, we'll be very happy to include you here on the Homefront. I'm going to focus now on a medium very near and dear to me is cable TV public access. Every company around the country has some version of public access. Access. Spectrum is the company in our region serving the community with this great studio resource. And we have two people here today involved with Channel 192. They have a special event coming up, and they've also brought back media training, where for many years they were an incredible source for people to learn about working in the industry, getting their hands on equipment. Well, that's come back now, and I'm very happy to have you guys here to share the good news.
Thank you, John.
Thank you.
Okay, sitting next to me is Mike Sweet, a broadcast engineer. I worked with Mike for many, many years on cable shows. It's really good to have you in the studio whenever I can.
It's great to be back.
And also we have Adam Hamling. He's the public access coordinator who's working on all these projects we're talking about. Adam, it's good to have you back too.
Thank you. Thanks for having me. I'm excited to talk about public access.
You bet. So, Mike, maybe a quick intro about how every company has one of these channels and why you might have 400 channels, but there's only one like this, and that's the magic door you can walk through.
This is, I think that we've told this story about 100 times, John, I think, over the years. Way back in and I think in the early 70s when the cable companies were coming through and there more and more television channels were leaving the airwaves and going to the cable with a hard line into the houses. And the people who had small voices and small channels, they started to get concerned that maybe they wouldn't have their voices be heard. So they went to the cable companies and they said, hey, we're worried we're not going to be heard anymore with all these cable networks leaving the airwaves, all these television channels leaving the airwaves. And so that's when public access was invented. I think that I think that there were public access channels across the whole country. Yeah. They tend to be very, very specific to local groups, our local areas. And you can find your public access studio in the northeast corner on Channel 192. We've been there I think we've been there for almost 40 years. Yeah.
It's a wonderful resource because I actually had a show there for about 22 years on the Homefront. This show started there. Many years ago, when I was also at WHUS at Yukon, it was a radio cable TV partnership, and that was 22 years. Jimmy Diaz and I started that show, along with Mike Nelson and some of your predecessors.
Yep, I've heard the stories of Jimmy Diaz.
Oh yeah, so there's a real tradition there, and the whole idea is it serves two purposes. One is you learn, you get your hands on the equipment, and the other one is you can communicate and tell your own story. And that's what these guys do with this new generation of equipment you have as well, which makes it easier than ever to do this.
Absolutely. There's so many places to put your content nowadays, now with things like on the internet, with YouTube, and I still like to see us as a viable source of not just borrowing equipment and borrowing production equipment that you wouldn't ordinarily have access to, but there's lots of learning experiences like you mentioned. I think that I've seen so many people come in and start making a show and they weren't sure what to do. And after, 10 episodes, 15 episodes, they start to feel like pros. And it just adds a lot of meat to your program when you have that kind of experience.
Yeah. In fact, that's where some students in high school get involved. If you're above 18, I think you've got to be above a certain age. College students can take a class, but when the class is over, you've got to take the car for a ride. You've got to get in there and use that stuff. And that's where your equipment training. Maybe, Adam, you could talk about the training. You're going to start it up again and kind of give us a little snapshot of what people will learn that will really enable them to become their own producers.
Yeah, I mean, it's totally kind of up for you. Like, I mean, we can do all of it from ranging from just a studio 3-camera setup. So it's kind of like any kind of studio with studio cameras and and you can be behind it, or being in master control where you can kind of switch your program and do it kind of that style. We can do field production equipment, so that's kind of like taking Sony cameras, or we have camera XA40s or GoPros even, right? Where you can kind of take that back and use that equipment. You can do an editing training where we can teach you on both Apple Final Cut and Sony Vegas Pro, where we kind of show you how you can compile your videos and kind of put your own little spin on it. So you can do all of it as much as you want or as little as you want. And I think it's a really good, valuable resource because I feel like in today's day and age, it's kind of gotten lost a little bit, and people don't realize you can get all this great experience with video production right in your neck of the woods.
Yeah. And lots and lots of work today is going to have some kind of a media component. It might not be a big part of the job, but somewhere it's going to be part, or it may help you get a job because you can do this as well as other things, right?
50 years ago, it was typing that was the skill you needed to get into work. Now it's posting on social media.
There you go. Well, they should still give typing tests, in my opinion. I mean, if you watch the Chiron on some of those newscasts, the way they spell stuff, it's unbelievable.
Oh, my goodness.
Now, here's a quick question without losing us. For the training, is it once a week? How do you package this training program? How does that work?
Well, we have two avenues. We really don't like to shoehorn people into a specific schedule, or if they don't need to wait till July in order to start a training. If you have a show you would like to make already, you can come in and talk with us. And we got about maybe 10 minutes worth of paperwork to do. We have to prove that you're a resident of our 16 towns, the Northeast Connecticut, and that you're 18 years old. After that, we can start your training. We usually meet with people once a week or twice a week until, depending on what it is they're trying to learn.
Yeah.
It can be something as simple as just spend 30 minutes showing you how to set up a camcorder on a tripod with some light kits. And we can also spend 2-hour sessions showing you how to edit together your show on one of our editing systems. We got an Apple computer and we got a Windows editing system that runs Vegas.
You got both environments. Nice.
Right. So there's that sort of you come in ad hoc and start working right away pipeline. But then also, too, we're trying to foster a group community learning effort where we actually had to put this on hold for several years, starting around the time of COVID.
I know. It was a very sad time, actually.
Yeah,
it was hard to shut it down.
Yeah, it absolutely definitely was. It was difficult. And I kind of, I was on bated breath for several years, hoping that I would be able to build a community back up. But starting July 9th on Tuesdays and Thursdays, I'm hoping to get a small group together to come in. If we can get a group of people, then we could do something in the studio, and I think that would be really exciting.
So you're looking around July 9th, Tuesdays and Thursdays?
Yep, we're going to have 7 programs, 7 classes throughout July on Tuesdays and Thursdays nights, probably from 6 p.m. to 8 p.m.
Yeah. So maybe I could ask you one thing, too, while we have you. We have a couple minutes to go. Just run down a few of the shows that have had time to get a following, that have been around for a while.
Okay.
Because it's such a variety. If you tune in and one show may or may not work for you, but stick around because, man, let me tell you, something will. There's a lot of variety.
Absolutely.
I was surprised.
I love some of the staples
it's kind of
on
like
our
old
channel.
freeform radio used to be, when you could do your own thing and do different shows on the radio, that kind of a thing, college radio.
I think the fact that it's decided upon by the community is a really big plus for the diversity. You can tune in and you can see faith-based programs. Sometimes churches will put their church programs on. Sometimes you'll see an individual who isn't affiliated with an actual church. They'll be sitting in their kitchen and they'll talk about their faith and how happy they are with that. Other times, political shows will come on, and that's a fun one to start a discussion about, of course. Outside of faith and politics, the sky's the limit. Since there's no limitation or there's no actual format dictated by the channel, I've seen shows come on from the college that are short films or variety shows. People will come on and they'll read poetry. One of my favorite shows, I'm sure you've probably seen it on, is Poem Presents.
Palm Presents.
You got it.
Gary Palm, man, talk about classic radio stuff.
Yes, Gary's a child of the 50s, and there's you definitely can tell that when you watch his program. He pretends to be an old 50s radio jockey, and he plays clips from the 50s, songs from the 50s, commercials from the 50s. Just a really great, fun show to watch.
Yeah. And what's the best way for people to get the schedule if they were curious to catch Gary's show?
The best way is to give us a call.
There you go.
And I'll send it to you. I'll email it to you.
Okay.
Can I say my phone number?
Absolutely.
860-456-8500. 456-8500. That's the best way to get in contact with either Adam or myself. And
I called and you pick up, man. You guys pick up. It's not like the old voicemail system.
Yep.
You guys are right there all the time.
Yeah, but we're there till 6. So after 6, we'll return your call the next day, definitely.
Yeah.
And, we're available to answer questions, too, if anybody has questions about training, or if you're unsure that your show is a good show idea, then we're going to reassure you and tell you that it definitely is. And, call me and get started. That's the number one piece of advice I tell everybody. Make your first show, then talk yourself out of it.
And we also have our website, too, ctv192.com or .org, yeah, gosh.
ctv192.org. That's where you can get the forms if you wanted to, for example, get a show. You can request a show that way, which is what I had to do at one point.
Yep.
And other information, too, about the trainings, right?
Mm-hmm.
All right. Well, I want to thank Adam Hamling and Mike Sweet for all the good work they do throughout the year to use our local cable TV channel as a community resource. Now, our radio shows are also airing on WICH AM and FM. That's covering Norwich and New London. We began that a few weeks ago. And there are cable TV systems down there have the same channels, as well. It's the idea, if you're a cable customer and you're down in Norwich, your local company will have something similar to what we have here in the Northeast, and they're all trying to do the same thing, is to use local media for people to do their own local productions, and I'm really glad to have you guys around throughout the year. Again, that's Channel 192.
Thank you, John.
Yeah, thanks for having us.
Have a great summer. Good luck on the open house, which again is going to be happening on Saturday, June 8th.
Yep, we'll be there from
12
1 to
4, 207 Tuckey Road. That's Saturday, June 8th, this coming Saturday. All right, guys, good luck. Take care.
Definitely.
Thank you.
Okay, another short break. We'll come right back. I'm going to talk about the Connecticut Tenants Union and have an update with Luke. Stay with us. All righty, we're back live here. Joel Hillman here with the headphones for our next phone conversation today. Every once in a while, I'm very happy to share some airtime with the Connecticut Tenants Union. They're covering people all over the state trying to organize individuals to deal with landlord-tenant disputes, how to learn about the law, how to protect yourself, how to be a good tenant as well, and do the right thing by your landlord to protect yourself from court. There's so many stresses happening here. So every once in a while, we have somebody from the Connecticut Tenants Union on board. His name is Luke-Melonakos-Harrison. He's a union vice president. And Luke, thanks for joining us today. I appreciate your time.
Great to be here, John. Thanks.
So one thing we could start out briefly is your thoughts on the session, which just ended, of course. There was a big movement, this Just Cause, that had to do with some control over the eviction process that was hitting a lot of people by surprise. Maybe you could just kind of cover how you felt about the session, and then we'll go into a couple of stories of success you had recently as well.
Sounds great. So it was a short session this year, which means that lawmakers were kind of at work from February to May, working on bills, passing them out of committee, and eventually bringing them to the floor. We pushed for our legislative priority this year, which was just cause eviction protection, which means requiring a just cause, a justification for utilizing the court process of eviction to, remove someone from their tenancy.
Right.
In Connecticut, currently, that protection already applies to elderly and disabled tenants in larger buildings. It has been on the books for 40 years, protecting a lot of people in those more vulnerable categories from sudden displacement without justification. We were pushing to expand that to all tenants in larger buildings of 5 units or more. Originally, we were pushing for a smaller number as well, but the bill that the Housing Committee introduced was 5 units or more. And we made it very far in the process. It was passed out of committee. We had over 20 co-sponsors on the bill. We were talking to legislators on a daily basis, educating them about the issue, bringing them up to speed about what we're seeing tenants go through when it comes to these no-fault evictions. We still thought we had a chance right at the 2 or 3 days before the session ended in that first week of May. But unfortunately, the Senate did not end up calling it to the floor for a vote, which means that another legislative session came to an end in Connecticut without any real meaningful housing policy, unfortunately. Meanwhile, the housing crisis is continuing to deepen and more people are feeling it.
That's true. And if you get into the issues of adding affordable housing across the state to deal with the housing shortage, that whole movement is also in limbo right now. So there's a lot of major issues that are just sitting there. And in the meantime, tenants have to deal with landlords day to day. And that's where we've had people on from Putnam in the Cargill Mills situation. And then you hear from people all the time, the system is not working well, so people are falling through, aren't they?
They are. And yeah, that's one of the reasons that we pushed so hard for Just Cause, was because there are so many tenants dealing with unsafe conditions, absentee landlords who just never pick up the phone, never send out anyone to fix anything.
That's right.
And not to mention, really drastic rent increases, $500, $1,000, this kind of rent increase that just upends people's lives. And yet, the ability for landlords who just want to maintain control and keep things how they are and not be held accountable for those things, they have no-fault evictions as an easy tool to intimidate people into silence. Because, if you're too outspoken or you try to organize, you might be hit with an eviction that doesn't have to be justified to a judge. So
that's very real. That's very real.
Yeah. So the two things really go together, needing to improve the health and safety conditions of people's housing, but also needing to be protected against retaliatory evictions.
Well, it's one of those things where, if somebody was naive to try to trust normal common sense, you would say as a landlord, if you maintain the property well, people will do the right thing by you. You'll be a service to the community, and you won't have to be caught up in so many legal things that might be distractions or expenses. And if you don't take care of your property, it devalues anyway, if you're serious. So, at some point you just say, where's the common sense in this? Where's the business school education failing people? Yeah, but anyway, I know that's something that goes nowhere. But the point for you is you do have successes. There's a couple of things. Ocean management was one. So sometimes with reasonable owners, you do make progress because they figure out this is in their interest as well to look at it a little differently.
Yeah, it's. I'm really happy to be able to share this update because I think when we spoke last year, it was not so easy. This was the same landlord company, Ocean Management, which owns thousands of rental units in Connecticut. It's owned by a out of state, actually not an American citizen, owns the company. So it's and they really corner a huge part of the rental market, particularly here in New Haven, where I'm located. And they are sort of a classic case of a slumlord that allows their buildings to fall into total disrepair, constantly being cited for housing code violations, and has been sued for damages by lots of different people who've developed health conditions from the housing. But one of our tenant unions last year managed to bring them to the negotiating table over a rent increase that they were trying to push through, and yet in the middle of those negotiations, they turned to the tool of eviction and tried to displace 16 union members from their homes. But the union fought back both through organizing a huge protest and mobilizing a lot of community support, and also with an affirmative lawsuit alleging that the evictions were retaliatory against the tenant union for acting like a tenant union.
Right.
And between those two strategies, we were able to get them to back off on the evictions and come back to the negotiating table and eventually agree on a 3-year contract for people to have much more moderate rent increases spread out over a longer period of time, and also have improved maintenance and communication standards from the landlord side of things. Well, the happy news from recent months is that 3 other buildings owned by the same company have also unionized and have now been able to bring Ocean Management to the negotiating table without that kind of knockdown, drag-out fight that we had with them last year. So that's big reason for celebration for us.
It is. It's a conceptual thing because you're actually educating the company to say you want more sustainable income that's more predictable. Keep them happy. And if you don't treat them less than animals and airplanes get better treatment sometimes, I think. But that's a bad joke.
No, it's true.
It's true, though. It is. The money thing is just really out of control sometimes. You had a couple of things to share, though. Something in Brantford was happening that was unusual. There was a big change in some of their regulatory system, and there's an opening. There's an opening for new people to get involved, right, in Brantford.
Yeah, this is an interesting one because the town of Brantford has just one apartment complex left of what people think of as traditional public housing managed by a Brantford Housing Authority, which is those are the entities that typically manage public housing in Connecticut. This is the last complex left, and it's all seniors and disabled folks who meet these income requirements, which are quite low. So this is a very vulnerable population in terms of their ability to access other housing.
Right. That's true.
And they organized for two main reasons. Well, I would say three main reasons. One was conditions on the property. There were broken lifts where people with mobility issues would be stranded in their apartments for days at a time, not able to get down to the first floor, and other health and safety hazards.
Sure.
Then there was the board of the housing authority was refusing to recognize what was originally a tenant association. They weren't intending to form a tenant union originally, but they wouldn't recognize them, even though that is something that is fairly common in housing authority properties. And then the third thing was they were asking a lot of questions about accessing public records, including the budget of the property, and not getting any response. Nothing was posted online. It was raising a lot of questions about the financial transparency of how it was being managed. So those were kind of the three motivations for them forming their tenant union. Thankfully, their efforts so far have yielded a lot of positive outcomes on the maintenance and property management side. Some of those major health and safety issues have been addressed. Unfortunately, the entire board of the Brantford Housing Authority has now resigned. Which is kind of the only real governance structure left of the Brantford Housing Authority since it's so small. It's just this one complex. So you've got a property without a landlord, if you will. And thankfully, the union has been doing a lot of outreach to the community to find people who can really serve their interests and be much more amenable to working with them as a tenant union, just recognizing that as the residents on the complex, they're not utterly helpless. They actually do have a lot to offer. They have a lot of knowledge to share. They have a lot of expertise. They can be taken seriously as a partner in the management of the complex and not totally sidelined. So we're hoping that this can set a precedent, actually, of housing authorities having positive and productive relationships with their tenants, open lines of communication, and a real transparency in how the place is being run, which, unfortunately is not standard in most housing authorities across the state.
I know it's a really nice principle of collaboration and not confrontation. A typical give and take thing, like it's zero sum. If I gain, you must lose, and it's up. What's interesting to me, too, is I've been on boards. If you're on a housing authority board, do you have any fiduciary responsibility for the money? Because if you're on the board, I know we had insurance. You were responsible for watching the books. And
that's kind of the main responsibility.
Right.
Yeah. Yep.
So, I mean, for them all to go at once, I can't be a gossip monger here and be unfair, but that's the people that were in charge of those dollars.
Right, exactly. And it's, we don't want to make any unfounded accusations, but the fact
of course.
one of the union's primary messages has been, we want financial transparency. We want to know where our rent money is going and what the delays are on getting these major, the lifts in particular, getting those repaired and other important, repairs that need to be done on the complex. Where is the money going, if not to those things? And then the board resigned. It couldn't help but raise some eyebrows.
Well, that's something that we'll follow up now because we're expanding our show, getting into Norwich and New London. So these issues are all statewide. We've covered things in Putnam and also in Waterbury. And we're trying to let people know that people are trying to use the system. They're trying to be positive. They're trying to find solutions. They're just not yelling because that's not doing anything. And organizations like Luke's are helping people to find their way. And maybe one last story, if we have some time, is in Groton. Something's going on there. Give us an update.
Yeah, well, this is not quite as victorious as the others, but it does sort of shed a light on what's going on and the dynamics that people are facing. There's this particular company. It's based out of New York, called Up Realty. Keep an eye out for it. If you're looking for an apartment, you may want to watch out.
Up Realty.
Up Realty. They have a tendency to buy up properties and almost immediately send out mass eviction notices to everyone who lives at the complex. And this is what happened in Groton. There was a complex called Ivy Court, full of residents, many of whom had lived there for over a decade. It was really heartbreaking to hear the stories of people talking about how their kids had grown up together and how it was they loved so much that they could trust that neighbors would look out for their kids if they were playing in the street or coming home from school.
Yeah.
It was just the kind of community where there was a lot of trust, and that comes from neighbors being able to live next to each other for a long time. When people are constantly moving in and out because of evictions and rent increases and poor management, it destabilizes community and erodes that kind of trust that can only be built up over time. So this was a community that had that, and yet the complex was bought up by Up Realty, and they immediately started evicting people. And we did, do a protest and got them to at least negotiate with some tenants, negotiate for more time, and in a few cases offer leases, although for dramatically higher rents than what people were paying.
Yeah.
But it was just really hard to see that happen because this company has done the same thing. We saw it in Middletown. It was really heartbreaking. A lot of seniors lost their home in that case. We saw it in Woodstock. Same thing where neighbors had been living next to each other for years or decades, and that was suddenly totally upended. And it just, this company is sort of particularly aggressive, but that dynamic of neighbors who have lived next to each other for a long time, all of a sudden being uprooted and kind of scattered to the four winds because a new company comes in from out of state and buys the property and wants to bring in higher income tenants. It's just really sad. And, people try to fight back, but as long as these types of no-fault evictions are legal, it's really hard, and you kind of don't have much of a leg to stand on in court. So, that's why we're trying to change the law, to give people more of an opportunity to defend themselves and stay in their homes and their communities.
And that's why we're on the radio today, is to get the information out for people to begin to look around their neighborhoods. In fact, that's the word I was struggling with. The community, we used to call it neighborhood, when your kids would go to your neighbors and people would at least know each other. And there is a way to do business without that damage, and that's the challenge. And that's why the legislation will certainly come up in the fall, and we'll be tracking this with you over the summer, Luke. Maybe we'll try to get you back in August or maybe July, depending on what happens with some of these cases as things come up with Cargill Mills and Putnam as well.
Yep, sounds good.
So maybe one last thing is give us some Facebook or a way people can connect to the Tenants Union and stay in touch with you in between our reports, but to get better connected to you and your work.
Absolutely. So our website is cttenantsunion.org. You can find us on Twitter, Facebook, and Instagram at cttenantsunion. If you send an email to cttenantsunion@gmail.com, myself and our other two officers of the union read those emails, and we will get back to you. If anyone listening to this their interest is piqued and they might want to organize their own building or complex or neighborhood, our next training is going to be the second weekend in July, and that would be the best way to get started in organizing with us. So just reach out to us through our website.
All right, maybe we'll follow up after that training and see who comes forward with some new groups to cover in the months ahead, Luke.
Sounds great. Thanks, John.
Thanks for being with us. I wish you a great summer ahead. Thank you.
Thanks. Take care.
Take care. Right. So that was Luke-Melonakos-Harrison, the Union Vice President of the Connecticut Tenants Union. All right, our time is up for this week. Thanks very much for sharing some of your time. We'll look forward to seeing you next week for another edition. If you want to get involved, don't be shy. John@humanartsmedia.com is the email. We'll see you next week.